So if somebody is about to go to some cruise and they are exposed to hot tubs and swimming pool and the whirlpool, etc., is there a concern about getting this kind of bacteria? I know that it can live in air conditioners and you have to inspect. So what are we looking for, and who should be really be concerned? Should they, if they have COPD or if they're smokers or immune compromised, cancel their trip until we figure out what's going on?
So, first, this is a bug, just as you say, that lives in kind of water sources. In fact, those water sources are usually the kind that make splashes or vapors or mists. It can live in air conditioning cooling towers, but now they should all be decontaminated on a regular basis. But nonetheless, that's one source. Sometimes in fountains, it's been associated with supermarket misting machines that keep produce fresh, for example, and also whirlpools and other kinds of sources. And the people who are at most at risk of the pneumonias are people with underlying illnesses and older people. Underlying illnesses usually related to the chest, lungs. If you're immunocompromised, and of course, if you're a smoker, that predisposes you to all kinds of respiratory illnesses. On occasion, people have gone abroad and acquired this in a hotel, for example, abroad, and then come home, and only when they got home got sick.
What kind of symptoms should people be looking for? Is it typical flu symptoms, or are there other signs and symptoms that they need to know about?
Well, that's why it's so subtle. The initial symptoms are flu-like. You get fever, sometimes chills, shortness of breath, a cough. Sometimes that cough is productive. That is, you bring up some sputum. If it gets bad enough and the pneumonia progresses, you can sometimes get chest pain. And of course you feel wiped out and very, very ill. So all of those things in combination sound like the flu, but if they progress, can indeed be indicative of pneumonia. And then when you're seen by the doctor has to think about this diagnosis in order to order the appropriate diagnostic test.
That's very important, because I think if you catch it early with very aggressive IV antibiotics, you can actually save someone from getting a full-blown sepsis.
Exactly. And this outbreak in the Bronx is fascinating because it's rather large, and I'm sure the New York City Department of Health, and they are expert, are working on this, and of course they can call out to the CDC in Atlanta for consultation. And I'm sure they're looking to see what's common among all these people who have acquired this illness. Do they all live in the same place? Do they all have religious services at the same place? Do they attend any kind of entertainment or other amusement place? Similarly, to see whether they are all tied together or whether this is I might call it a splurge of coincidence. When you have this many cases, you tend to think that there might be a common source out there, and that's, I'm sure, what they're looking for.
Well, it's interesting.